All right. Okay, I think we can start our session. So first of all, dear Nordic friends and friends of Nordics, welcome to our webinar, How Nordic countries and Singapore are using digital to fight COVID-19. This event is collaboration between the Nordic Innovation House Singapore and the UNDP Singapore Global Center for Technology, Innovation and Sustainability. My name is Sami Jääskeläinen. I'm from Nordic Innovation House and I will be your host and a moderator today. So it is my great pleasure to warmly welcome you all. We have a very exciting keynote today, but prior our panel and the company showcases. But before we go to that, a couple of words regarding Nordic Innovation House and how do we operate here in Singapore and globally. Nordic Innovation House is a community platform accelerating and supporting high-quality Nordic tech startups and scale-ups and growth companies, which are coming to Singapore. And of course, for many of them, Singapore is just a springboard then for the rest of the markets in Southeast Asia. We have currently 4 offices globally. Silicon Valley was the first one, opened in 2014, followed by New York 2017. Singapore and Hong Kong were inaugurated in 2018. Now a 5th one will open in Tokyo this summer. Our support is coming from all the way from Nordic Council of Ministers and an organization called Nordic Innovation, which is headquartered in Oslo. And in Singapore, our team has representatives from Business Sweden, Innovation Norway, Finnish Embassy, and Promote Iceland. So I guess hand in my heart, I can say that we have quite a unique collaboration between all the Nordic countries, and we share the mission of really building these bridges between Nordics and Southeast Asia. So once again, welcome all. And next, I would like to introduce and hand over to Bradley Busatto. He is a director at UNDP Global Center on Tech, Innovation and Sustainability here in Singapore. And he will share more details how UNDP is fighting against COVID-19 with different digital tools and how they are supporting emerging markets. Bradley, over to you.
Thank you. Thanks so much. Let me just share my screen and then great. Just want to make sure the technology is working. Everyone can see my screen?
Yeah.
Yep. Okay. Super. I will be very quick to get on to the main events, but just to first of all thank you to Sami and to Riku, especially from Nordic Innovation House. Fantastic partners with UNDP and the new UNDP Global Center here in Singapore. I think our mandates and missions and interests are really aligned. Thanks also to Chee from the government of Singapore for joining us, and to all of the panelists and all the participants. So I think it's obviously extremely timely to talk about simple digital tools that we can use globally to fight against COVID-19, and especially digital tools that are coming from some of the world's most technologically advanced countries, like the Nordics and Singapore. But there's something else that those countries have in common. They're also real pioneers in sustainability, so very keen on promoting technology for the point of making a more sustainable world. So with that, I wanted to spend just a couple of minutes talking about the global impact of COVID-19, but especially the impact on the developing world. I don't think the media in general have reported enough maybe about this. So, and I think the real catastrophic risk of just all sorts of increased poverty, increased fragility across the region. So we're in Africa, for example. It's not just a health crisis, but it's an all of society crisis, right? They're starting with extremely weak or not often non-existent health systems. Supply chains are being disrupted. Food supply chains are being disrupted. There's some estimates that a half of all jobs in Africa might be lost because of this pandemic. The economy will be shrunk hundreds of billions of dollars in aggregate. Something like 250, the World Food Program estimates that 250 million people will be facing acute hunger by the end of this year. So it's really, as the Secretary General of the United Nations has said just a few days ago, it's a crisis that's unprecedented in the 75-year-old history of the United Nations. Actually expecting poverty levels across the world to increase in many countries by the end of the year, not decrease. So we think that, you know, if countries like Iran, then Italy and US are not coping, then you can imagine what the potential for catastrophe is in Africa. There have already been quite a few cases. We're sure that the number of cases has been underreported, but that's where the UN is focusing its attention. Just to illustrate this a bit more, some of you might have seen these figures in this graphic, this table in the New York Times a few days ago. It's just this is a table of sampling of some countries in Africa and the number of ventilators. So Somalia, the entire country, has no ventilators. The DR Congo has 5. That's 20 million people per ventilator in their country. South Sudan has actually more vice presidents, 5, than it has ventilators, 4. So I think this graphic really kind of shows the story in terms of medical infrastructure and technology in Africa, but it's only a small slice of the overall picture and the overall risk that's there. Really, the risk is just setting back so much progress that's been made, setting back the global goals, the sustainable development goals, and ambitions for sustainable development across the continent. And I'm just focusing for illustrative purposes on Africa right now, but the same could be said across the developing world, in Latin America, in parts of Asia as well. So what is the UN, in particular the UNDP, UN Development Program, doing? Focusing on sort of the 3 angles, the before, during, and after: prepare, respond, and recover. Focusing then across health system support and shoring up government capacity while they're in crises, and then the important work of coordinating for the UN system of needs assessment. So right now, one of the key things that we're helping governments do across Africa and many countries across Asia as well is helping with procurement of much needed medical supplies. But we're also taking the opportunity here to focus on how we can support from a digital point of view. And I wanted to talk about that and then also very quickly introduce what we're doing here in Singapore. So in Singapore, we have just recently, just last year, set up UN's first center really focused on technology, leveraging technology for the purposes of accelerating sustainable development in the developing world or in emerging markets. So how do we use the promise of technology to help people better their lives out in the developing world? And so focusing here on digitalization in cities and digital agriculture and sustainable finance. But right now, we've very much pivoted towards, over the last couple of months, pivoted towards how do we respond to COVID-19 for the sake of the developing world. And got 2 main priorities, urgent priorities right now. One, we've set up a kind of a digital toolkit, a digital toolkit of open source digital tools from Singapore and from around the world that we think could be immediately helpful for countries in the developing world, for governments and societies and citizens to easily tweak to fit their context. You just think of what Singapore has done with their Trace Together app, with their dedicated WhatsApp channels and chat bots and so forth. Of course, Singapore did that on the basis of this really strong digital foundation, but now that we have these tools, we can, I think, quite easily tweak them to help countries around the rest of the world. And that's why I'm particularly keen on this session today. So we're doing that, but we've also then launched a global challenge with Hackster, the world's largest community of hardware innovators, like 1.5 million folks in that community. And it's very much linked up. We've linked this challenge and this platform itself is linked up with Google and Amazon and Microsoft and all the really heavyweights in global technology. And it's basically a global challenge for open source technology to help with detection and prevention of COVID-19, especially focused on the developing world. So go check that out online. And if you'd like to participate or support that, we think that that could too have a real far-reaching impact in the weeks and months to come. So with that, just a brief introduction of the context, I think, and the challenges and opportunities we have. I think digital can play a huge role, especially in the immediate response and coordination from governments and societies all across the world, not just in rich high-tech countries. So very keen to learn more from all the panelists today and to work with all of you and all of those listening in on the webinar. So thanks a lot again to Sami, and look forward to the rest of the afternoon. Sami's on mute.
Sami, you're muted.
Yep, Sami, I think you're on mute.
Yes, sorry. All right. So thank you, Bradley, for sharing that. And likewise, I'm super excited that we have this rare opportunity to really have all the Nordic and the Singapore representatives here today with us and sharing really kind of like all this learning and also lessons and experiences while developing these tools. So with that note, I would like to then introduce our panel today. So and like I said, really honored to have all of you here. So first one, we have Molin, who is the head of HAC for Sweden, also being is currently the national curator at EU versus Virus. Norway is represented by Arild Kristensen. He is the CEO of the Norwegian Smart Care Cluster. Then we have Marko Vänskä from Finland, Business Finland, head of industry growth capital. And then we have our Singapore representatives, Chee, who's a director at Smart Nation and Digital Governance Office. And from Iceland, we have Ingi, Steinar, Ingason, who is a team leader, National Center for eHealth and Directorate of Health in Iceland. So welcome all. We are really, really happy to have you all here today. Please make sure that you are all unmuted, so then you're not making the same mistakes as me just now. But again, welcome for all our panelists, and thank you for allowing us and our audience to pick your brains today and hear all the very, very valuable insights within this current crisis. And I would like to start really with the big picture. So I would give you 1 minute each. So please tell us briefly that what kind of digital tool development activities, either on the government side, or it also can be on the grassroots on the community side, your country has organized lately. And also maybe if you can highlight 1 or 2 most potential outcomes that have come out from these activities. And we will start with Molin, please.
Hello everyone, Molin here from Sweden. Yes, on a mission from the Swedish government, I set up Hack the Crisis Sweden, an online hackathon to tackle the challenges created by the current crisis with COVID-19. And the 3 challenges that we worked on were saving lives, saving communities, and save businesses. And we were 7,439 participants from 91 countries We had 200 mentors and 160 partner organizations, and this resulted in 530 submissions for solutions within these 3 challenge categories. And the 6 winners are now been taken care of from the government side to make them a reality within the next 2 months, because we need the solutions now and not within half a year or so. And coming up this weekend, on April 24 through 26, the EU Commission is organizing an online hackathon called EU versus Virus. And this is to collect all the national initiatives that have been all around Europe, the Hack the Crisis hackathons, and to create unity within the EU. So all the 27 member states and also Ukraine, Norway, and Switzerland are joining, and we are aiming for 60,000 or more participants. And the goal is, of course, to gather as many good solutions within the challenges I mentioned and to scale them across the EU.
Great. Thank you. And I will pick your brains later on regarding this EU versus virus, because that's a great example of the knowledge sharing. Let's move on. And then Norway and Arild Kristensen, please share what kind of initiatives are coming from Norway.
Hello, Arild Kristensen here. On a government, from a government side of things, we already had in place an eHealth strategy, building sort of a digital infrastructure into the homes of people. So the municipalities who deliver care in the homes had started a route of a digital highway, so to speak, with the solutions that you can see on screens. And we had also, over several years, extensive testing on remote treatment type solutions and video consultations. But in the past 5 weeks, what's happening in the digital side, and of course I have to say that the #1 priority for government and municipality has been emergency preparedness and infection control equipment like masks, gowns, ventilators, so on. But as alongside this, there has been a really tremendous push of digitalizing health in Norway that we haven't seen over the past 5 years. And over just to exemplify the adaptation of video consultation for GPs rose from 10% to 90% for 3 weeks in use of that type of solutions. We see municipalities that had started the route on eHealth going much faster, implementing really fast, bypassing tenders and everything. And so we also see that they take initiatives to buy like electronic pill dispensers for municipalities. So a lot of things happening in the infrastructure to care for people at home, vulnerable people like cancer patients and so on. On the national level, we also see the tracking app, infection tracking app that came out just a week ago. And I think more countries will talk about that. That has been a collaboration with other countries, but this is just out. On the grassroots side of things, Hack the Crisis has been in Norway as well, and as Anne said, there will be a European one. There is also an open source platform called Immunity, who try to see who have had the COVID, who has been immune, so they can be called back to service in the society. So basically, that's a brief overview from Norway.
Okay, good. Thank you. Next, I'm going to hand over to Marko Vänskä from Finland, and 1 minute. So try to, Marko, summarize very briefly what kind of solutions and initiatives Finland has been doing.
Okay, thank you. So Business Finland started this tracing topic already in mid-March. And we clearly found it out that there's really 3 topics to be concerned about: trace, test, and isolate, all equally important. And about this technology for tracing, we have a team of companies and experts who studied these technologies available from a different part of the world and on code level. So this was the kind of original task on our side. And we found out that there are a lot of legislation challenges, a lot of data protection questions that needs to be answered before this kind of system will be accepted to use. So we put a lot of effort on that side. So there are 3 possible choices to implement that kind of solution for tracing. So centralized, decentralized, and a hybrid. And based on the EU Commission recommendations, so these not centralized solutions are easiest to implement, and that would be maybe something to discuss in the future for global standardization, etc. So there is currently a know-how and resources in Finland to implement this in 2 weeks to 4 weeks in anywhere. So basically we have enough knowledge and capabilities, and code itself has been implemented. But on addition to that, so we have a lot of other products as well on the self side. So there are solutions related to epidemic and relief and crisis management, which can be used for this particular pandemic relief. So these are including test management for virus, mobile diagnostics and guidance, and virtual remote care, secure messaging, symptom tracing, and assessment, communication optimization systems. So just to name, list a couple of names of companies like Reactor, Futurize, iStock, Smartly.io, Ninjat, MariaDB, and Tieto. They are very actively working on these topics currently. Some of those companies are also having their own pitching or communication session in this seminar. So this was messages from Finland.
Okay, great. Thank you, Marko. And like I said, all the audience, Marko and all the country representatives will be in the breakout room number 1. And so you can ask all the questions and really go to the details with all different kind of solutions. Great. Next one, we move to Iceland and Ingi, Steinar, Ingason.
Yeah, good morning, everyone. We have made a lot of different digital solutions here in Iceland during the last few weeks. Most of them have been directed towards easing the burden of the healthcare workers, but also making sure that patients can actually get services as they need it without coming on site. And large-scale testing has been done here in Iceland. That's quite different from many other countries. So we have tested already more than 12% of the population here in Iceland, both with tests with patients that have symptoms, but also screening among the public. So everyone can actually get a test if they want it. So everyone tested positive gets a phone call from our tracking team, and everyone at the risk of being infected, being close to those infected, they are put in home quarantine for 14 days. So this work was getting quite time consuming. So we decided to make a tracing app and called Rakning C19. And that has been downloaded by more than 50% of the adult population in Iceland already, and has proven to be very helpful in the contact tracing in many cases. So this is something, even though the crisis or the number of positive tests are going down quite a lot, we look really into having this app running even further into the future, so we can release some of the restrictions that we have without really risking that there will be a lot of outbreaks around those patients that actually will be infected. Okay. So we also, one of the things we also did was put up a website for all the necessary information about the COVID crisis in Iceland. So this has been the go-to website for the public and the media, and also for healthcare workers. And you can see there's a graph on the right side on my slide here. That's our website. So we are keeping track of all the statistics and all that. We have been using our patient portal a lot during the crisis. We have we have been sending, for example, all the negative tests to the public. So we've been sending thousands and thousands of tests every day through the portal safely to the people. So they don't have to take up time from healthcare workers to phone them or send them the results. So they just get the test results as soon as they are ready. And many other solutions have been developed. For example, monitoring of COVID patients on the outpatient side. And of course, the telehealth has been going up through the roof here also in Iceland.
Very good, very good. Okay, again, a lot of solutions, a lot of good ideas, a lot of good implementations. So we will continue the conversation in the breakout room. Next, I'm going to hand over then Chee. Please share us the latest lessons and initiatives from Singapore.
Hi, my name is Chee. I'm the director in the Smart Nation Digital Government Office. I'm probably just going to give very brief descriptions of the tools themselves, because I'll point you to a website or info sheet that you can download and get in more details. But I'd like to share a bit more on the key principles and how we've organized the digital tools. I think that could be quite useful to think about. The first, when we think about how to design digital tools, it cannot be the technology that's trying to push for a problem to solve. We are very mindful that first, it must be guided by, first and foremost, by public health requirements, as well as our national COVID-19 response strategy. So, you know, if the public health authorities need contact tracing to be done in a certain way in order to respond, then the digital tools have to support that. And it cannot be that we produce a product that, well, has to force people to change how they work. So I think that's something first we are very mindful. Secondly is that putting users at the center. There has been sort of the whole effort that we've been doing for Smart Nation, for digital government. So when we put out information out there, it must be easy to understand from the citizens and businesses' point of view. And the third point that I want to make is that it's not something that is government doing everything ourselves or it's a one-way download. Actually, we want to facilitate as well as empower community responses. So some of these could just be putting out enough information that people can make good decisions on their own, or involving sort of like parties, different partners. And that's the whole genesis of the SG United. Maybe if I just wrap up, you know, we have grouped our digital tools maybe according to 4 key problems to solve. We are about communicating timely and accurate information. The WhatsApp has been pretty good, more than 1 million users. Enhancing community preparedness, things like having a spaced out portal to show hotspots, crowded hotspots. AI-enabled temperature scanners. That was a big problem because not enough scanners that were readily made, and we had to retrofit some of them and add AI to it so that it can be good enough. Contact tracing, I think Trace Together, a couple of other countries just before us also mentioned about tracing apps. We have 1.1 million users at the moment. We are starting with a national check-in system. We have had tens of thousands of check-ins a day, but with the sort of circuit breaker, I think the activity has gone down a little bit, fortunately. And lastly is about a bit more on enforcement, digital tools like making sure people stay home when they're supposed to. So that's all I have. Happy to engage more during the breakouts.
Yeah, great. Thank you for sharing that. And Chee, let's stay with you for a while, because next one is, I want all the panelists to highlight very briefly, like what has been the #1 challenge, what you have faced, and how these different tools, what different countries have been developing, has been helping to tackle that.
All right, maybe I'll just give a very quick response.
Mm-hmm.
I think when it comes to the nature of this virus, and we are always short of data, it's like driving with just a rear view mirror, right? The kind of number of cases that you see right now are the result actions that had happened 2 weeks ago or thereabouts, because it takes time for incubation, for disease to spread, and for testing and for confirmation. So you don't actually quite know how it works. So if you just imagine yesterday, our Prime Minister had announced enhanced measures. We're just only maybe starting to understand how the circuit breaker measures that had been put in place about 2 weeks ago are starting to work. At the same time, you've got to decide, do I do something now, but can you afford to wait? So I think that has been the biggest challenge throughout, making decisions when the data is not readily available, and even the nature of the virus, how it spreads, asymptomatic, symptomatic, that is something we're just learning continuously and changing.
Good. Ingi, how about from Iceland? What has been the #1 challenge?
Yeah, our main focus the whole time has been making sure that the healthcare system in Iceland can actually cope with this increased load from the pandemic. So what we have been focusing on is trying to make the life of the healthcare workers easier, so they can actually spend time on actually treating patients. So, and also making sure that people can get their services they need without showing up at the clinic if they are at risk of being, if they're vulnerable with underlying diseases, for example, or if they are in quarantine or isolation, they can still get the services they need. So this has been our main focus.
Good, good. Okay, Marko, how about Finland?
Okay, so as we were talking about tracing, testing, and isolating the infected, so there's a threefold of challenges. So one is related to tracing, because it has to be definitely comfortable for people to use it, and so that it's not about tracing of people; it's tracing anonymously the virus. And so that is definitely number one. It has an impact on the usage level, so we need to do it very carefully. So testing is the huge investment for the countries. So who to be tested and how to prioritize the tested people, it can be automated. So we can use AI tools and machine learning tools to actually make the recommendation. And in this also the tracing and kind of giving the information that this person probably have infected. So this is a very good signal for having a test or guiding person to the tests. And the third one about the quarantine. So if the person is infected, say on people's kind of own judgment and trust them that they keep themselves inside, not infecting the other ones. So they are kind of threefold of challenges, but I think we are in a good way to solve all of these. And one point about the usage level of this kind of tracing system. We target to have, for instance, in Finland, 4 million users. We are a population of 5.5. And for that kind of leverage, we need a special acceptance from the people. And our one company from Finland called Supercell is also helping us to find out the best way to kind of get this information to people.
Good. Then how about Norway? Arild, so what's been number one challenge, and how then the digital tools have helped to tackle that?
I think the number one challenge has been emergency preparedness for both hospitals and municipalities, how to rig to take a huge number of patients and treat, and of course also test. So once the first week to things become in structure, I think the tracking, like most people said, the tracking and the continuous testing tools will be very important now going forward. And otherwise, it's elements of what has been said by the other people here in the call. We are not that different, but emergency preparation now being under control, that the continuous tracking and monitoring and testing will be on top of how we progress and how digital tools can help the crisis going forward.
Good, thank you. Sweden has been facing similar challenges, or do you have another one, a new one, which is number one challenge, and what kind of tools?
In many respects, Sweden has had the same challenges as many other countries, of course. Shortage of hospital beds and shortage of supplies and so forth. But Sweden has, in one way, been trusting in people to keep the social distancing and to adhere to the rules more than making laws to make people do this. With this said, the number one challenge has been trying to move fast enough, mobilizing and coordinating the efforts from different parts of society, public sector, private sector, and citizens, and so forth. And right now, there is an app one of the winners of the Hack to Crisis Sweden that can show immunity, that you can get a mark for immunity. And this is on its way, and I believe this will be important to get society going again. And it's also, that solution is also competing in the EU versus virus hackathon this weekend, because of, in this context, more than ever, global cooperation is important. So scaling this to a EU level is of course important.
Good. Okay, and I want to continue with this topic and really kind of like talk more about the knowledge sharing between the different countries. Again, national, community, grassroots level, and you've been involved very heavily with this EU versus virus, which is a great example of this knowledge sharing. Could you share a little bit more kind of like some key learnings from this process? I know that the main hackathon will happen, is still about to happen, but so far, obviously, it's been a long journey, a lot of preparation. So how does it look like? What are the key points to share?
The EU versus virus hackathon coming up is really a good example of all countries coming together and really making an example and a true effort of bringing together all the solutions from the national hack to crises that have been going on around Europe and around the world. So with 27 member states participating and also a few more, I think the possibility of coordination and really lifting the good examples and the good solutions and scaling them are the possibilities are great. So since they are aiming for 60,000 plus participants, I really believe that this is the way to scale the best digital solutions.
Good, good. And I'm sure Marko already shared some pointers, and this is going to be probably one of the hot topics in the breakout rooms. Like, okay, how about legislation, data privacy, and all of that? But let's come back to those later on. I want to go to Iceland, Finland, and Singapore, because I know that all of these countries will be working with the different kind of tracing applications, and also there has been a lot of sharing between the different countries. So good learnings from there. Maybe Marko, you want to briefly go first?
Yes. So just checking. We are number 3 or number 4 now.
This is
so okay. Regarding sorry. So regarding this collaboration with the different countries. So this has been utmost important for us when ramping up our knowledge of this tracing, and special thanks for Singapore GovTech, who has been really open to share their knowledge about this different tools for taking care of the virus. And we have a direct connection to GovTech technical teams. Also, we have a direct connection to German technical teams, plus a Swiss team who are developing the same approaches solution. So cooperation with different countries is important, but then also cooperation with different companies in different locations like Google and Apple is as important as well. So we have a connection to them, and we are talking about this kind of compatibility issues with the solution with them directly. So this is very important that we share information, and I think that is the key reason that we are so far in developing such tools already now.
Good. And maybe then, Chee, we go to you next. So Singapore was one of the first countries to develop that Trace Together app, and now there's been a lot of sharing then with other countries. A lot of requests are coming in. What would be the key pointers from your side to share?
Thanks, Sami. There was actually certainly a lot of interest. We were quite overwhelmed. I think when we first developed the app, we weren't quite sure how many will use it. The development team actually took their own bets, and they landed on between tens of thousands and maybe low 100,000, and now we are at 1.1 million and rising. So that's been, I mean, a really humbling process. There was a lot of requests from many countries because I think we happened to be one of the first few that developed an app and implemented at scale. But it took us, I mean, so we have set up a website. We have open sourced it. It's on bluetrace.io. You should, I mean, feel free to look at it. We took a bit of time to publish it because we want to develop first a policy brief that explains to people how to use it. I think when we shared it, we were sharing our experience, we realized that most people don't even understand the contact tracing process in their own countries. Right, you just think that the technology is a silver bullet, but you first have to understand how actually the public health response is going to be. We also have sort of a blue trace technical protocol that lists out the way we implemented, as well as limitations. I mean, I'm sure many people have know about the limitations of iPhones for background Bluetooth scanning in general. We're quite happy that Apple and Google, seeing all the interest from around the world, has released a protocol or is collaborating on this. We're cautiously optimistic, but I think one key point that many countries are now grappling with and working through with Apple and Google is the degree to which the health authority is part of the contact tracing process, right? I think health authorities generally need to know not just who may have gotten infected, but how did they get it, because that influences or that informs what happens next. Do you close down certain hotspots? Who do you quarantine? And that's something that I think countries might need to collaborate on a bit more, working with Apple and Google.
Good. Then, Ingi, let's talk about Iceland and this tracing up. You mentioned previously, like almost 50% of the people in Iceland are currently using the app. That's a huge achievement. So how did you manage to get the usage to that level?
I think the reason behind that is actually we have this slogan during this pandemic here in Iceland that we're all in this together. So it was a huge move. I mean, after we launched the app, we got 65,000 downloads in 24 hours. So almost half of who has been downloading the app actually did it in the first 24 hours. But cooperation around creating the app was without actually getting the source code from other countries that have done the development already, even if some of them had not published their app already. Got the code and it speeded up our open source our product also. So other countries are trying also to make things in their countries. But I think the key issue here with the tracing app is the situation in each country is so different. You can't actually just take an app from another country and implement that in your country. That's the situation is quite different. And GDPR, for example, and all those things.
Exactly. And I think that this is going to be also one hot topic question in the breakout rooms. It's like, it's one thing to develop a technology, but how you will get people to use it. But let's save that to the breakout room. Moving forward, as we all know, unfortunately, there is a very, very high chance that there will be more similar pandemics in the future. So what would be then your maybe one or two key learnings from this current COVID situation, and then also maybe kind of like what should and could be done better, faster, differently next time? And maybe we, Marko, start with you.
Okay, thank you. So now we seem to have a kind of end of this wave taking place, but this is mainly due to the isolation. People are staying home and not meeting the others. So next wave definitely will come before we have a vaccination in place. So unfortunately, we have a situation that we are going to see this kind of pandemics in the future, but this is now a right time to look at the kind of international cooperation, how different countries are working together, and what are the kind of common denominator for tools to be used. So that is also we can first do it one level and then go and develop that further. But definitely there's a place for collaboration and cooperation with different countries. We cannot afford to have a next wave so that we don't have these tools available. These waves are very expensive. So now we have a time to actually develop these and implement these together internationally.
Good. So international, more stronger collaboration. Okay, Ann, what
yes,
would be
I
your one or two key learnings, and then what could be done better next time?
I can only agree with the previous speaker that more organization and coordination will be needed faster. But I think the main dilemma here is that we don't know what the next crisis will be. Maybe it's a pandemic, maybe it's something else that hits the world. So in order to be prepared, we need to prepare for so many different scenarios. So I would say that we need a much better preparation and for the next crisis. And that includes a faster crisis organization that can move faster and apply the things that needs to be done. But of course, if we play with the idea that the next big world crisis is a pandemic, of course we will have learned a lot from this one. But really, I think we need to be more prepared for global cooperation and that the next crisis may not be a pandemic.
Good, thank you. Chee, what would be the key learnings from your side?
Well, I mean, hindsight is 2020. I think now's not the correct time even to go back and say what we do differently, because there's no guarantee that will even be correct. But I think looking at where we are now, some of the urgent pieces of work on the technology front is to how do we better organize the data, making sure that they are in the right sort of format that we can really help the contact tracing, do the analysis. There's been many different companies that have been pitching different AI tools, data tools. I think those are all helpful, but there's actually fairly important prerequisites that you must have the data in a clean format in the first place. At the same time, the contact tracing teams are just ramping up. We started with maybe one team, then went to 6 teams, 20 and 30 teams. Then, how do you organize that all at the same time? It's like, what do you call it? Trying to change the engine as you're flying the plane, right? And it's a jet plane, so it's really tough.
Good. Arild, how about key learnings from your side, which would help them to prepare for the next time?
I think one key learning has been that we were not prepared for a crisis of this scale. I think we have, so on the national level, on all parts of the society, nobody had managed to prepare for or envisage that we close down the society. So I think that is a key learning that these are brutal times for a lot, and we need to prepare for another wave, as Marko says. And then if we look at the global side, since viruses does not know any borders, it is a key that the world unite in how to respond and share knowledge and data instantly across, because it takes 18 hours to fly from one end of the world to another, and then you have it. So I think this will really foster international collaboration on that could be a benefit on other stuff as well. Also to be aware, like the opening statement from the UN of the crisis in Africa and other countries that a bit far from us in Norway and Nordic who has a different view on things. So I think we need to be reminded on that we are all in this together as a world, not as only our individual countries.
Yeah, and then clear communication, open communication, a better international collaboration. Great and super important, but also challenging points of. Ingi, how about you?
we are quite used to dealing with all sorts of crises here in Iceland, with all the volcanic eruptions and earthquakes and snowstorms and all those things. But we are, and because we are so few, our communication channels are quite short. So we are quite used to solving problems as we go. But luckily, here in Iceland, after the SARS outbreak in 2002, we actually made a detailed plan for a pandemic here in Iceland. So when we saw what was going on in Wuhan, we started revising that plan and thinking about how we could actually fill in the blanks we had left in 2002. So this has been very helpful in our efforts here in Iceland. So I think we will learn a little bit from this to plan more for things in the future.
Good. Let's move then on to the final wrap-up question, which will be for all. So I come from Finland. Finland has been selected the happiest country in the world 3 times in a row. So I want to end with a positive note. 30 seconds, each of you, what is the one positive outcome of from this current crisis? Anna, do you want to go first?
Necessity is the mother of invention. I think that sums up the mentality that has been going on right now. We tend to be more innovative and prone to create new solutions when there is a pressing need to do so, when there is no other alternative or option. And this crisis has shown this in Sweden for sure, and around the world as well, I believe. And people have truly shown their best side. Generosity has been great. It has exceeded our wildest expectations when we organized Hack the Crisis, for instance, from companies, from government agencies and other parties. Everybody was willing to go that extra mile to really help out. And that is the good part in all of this.
Great, awesome to hear. How about then, Chee? What would be your one positive, most important thing?
Well, I think the one positive thing, at least in Singapore, has been sort of the whole SG United movement. It's not about technology, it's that throughout this entire crisis, people are staying together. I think, regardless of technology or the health response, what's more important that we are acting as one country. So that's been quite reassuring.
Great. Ingi.
Yeah, in addition to the same things like Anne was describing here, we have experienced in Iceland. I think from my perspective, I think the positive thing will be that telehealth actually has shown its positive sides here, and this is a much needed transition in a sparsely populated country like ours. This has been people have been reluctant to take up this services in Iceland until now.
Great. And Arild, what would be one key thing from your side to share?
I support, of course, Ingi. We have the same, that we have digital health and home care has been digitalized much faster during the past month than over the past couple of years. But I think the key point to take from a human side is that we realize that the world does not revolve around me. You are part of a bigger picture, and I think people actually have been reminded to care for others, and what I do has effect on other people. So I think that's as a wake-up call for a lot of us in the society, that we are part of a community and we need to act as such.
Right. And Marko, final third from.
Okay, so most of the topics has been already mentioned, and really thanks to all panelists for this excellent time. So, but I see that the nations has become more closer to each other. So this has been really like a big movement for that direction, and barriers has become lower to ask help or to give help, and really see this kind of openness in code development and open code sharing and all that stuff. So this is a really good situation. I called another day to my colleague in Business Sweden, and we had a talk that, okay, shall we do something together for this? So it was immediate, so 5 seconds, and we were on the same side and fighting for this challenge. So I feel that this is a good move also.
Good. It's always important to find the silver linings. Great. So with these positive notes, we will conclude our panel discussion today. But like I said, we will continue then in the breakout rooms. And again, thank you for all of our panelists for sharing your experiences and all these learnings with our audience today. And again, a breakout room reminder. So we will have on the chat box basically all the links for the different breakout rooms. And before we let you go there, we want to keep the stage for the companies who have been building these and also implementing different solutions to fight against COVID-19 digitally. So we will have 9 companies here with us today, and all the companies will give a quick 30-second pitch. And after that, we will take all the audiences to the breakout rooms. And the order is we will start from the first row on the left. So Matti Junila from smartly.io, please.
All right, thank you, Sami. So quick introduction, I am Matti from Smartly, and we are a Finnish software company specializing in social advertising. Basically, we help brands drive better ad performance across social advertising channels. And if you are interested to hear more about how has COVID-19 impacted that landscape and what we are doing about it, you'll need to join me in breakout room number 2.
Thank you, Matt. That was 22 seconds.
There we go.
All right. Next one, we have Gudjon from Origo, please.
Hi all, my name is Guðjón and I'm the Director of Healthcare Solutions at Origo in Iceland. We developed the National Patient Portal solution used in Iceland in close cooperation with the Directorate of Health. The portal has become a very effective tool to help deliver healthcare service, since this portal is available to all Icelandic citizens, and all public healthcare providers, and many private actually, are connected to it as well and can communicate with their patients through it. During the pandemic, we have added multiple features, for example, the video conferencing Ingi mentioned before, and delivery of COVID-19 test results to all those who were tested. Thank you.
Thank you. Again, I've been saying this many times, but I love this when the Nordic companies are pitching. If you give them 30 seconds, it is usually a few seconds less, or spot on 30. Thank you. Next, we have Ole from Dignio.
Okay, my name is Ole. I'm COO. Dignio. So Dignio is a Norwegian eHealth company. We're a cloud-based connected care company. That means that we are specializing in connecting clinicians and patients. We offer a solution that allows clinicians to have automatic triage of patients. On the patient side, we allow them to have an app where they report symptoms, where they can do their vital signs, video consultations, chats, etc. We are active in Norway, UK, and in China.
Very good. Thank you, Ole. Next, we have Virpal from Digital Talk, please.
Hi, this is Virpal here. Can you guys hear me?
Yep.
Perfect. We are a interpretation agency on demand, which means that we can instantaneously give access to language services. Our primary users are healthcare providers, government, public sector, and which means that we can instantaneously give access to language services where a patient who is non-local language speaking can get access to healthcare. We are also providing AI services in the language sector, and will be and have launched a video solution as well for allowing clients and patients to be able to get access to healthcare from home in their own language. Thank you. I'll be in room 2 for more information.
Great, thank you. Next, Ninjat and Ville Mujunen, please.
Hi. What kind of digital messaging services are you dreaming of? I'm Ville Mujunen from Ninjat. We are offering tailored chat, infobot, and video messaging services in your company look and feel for web, mobile, and also your mobile apps. I will be speaking in the breakout room 3 about our COVID-related deliveries, for example, doctor-patient video consultations, infobots, and chat messaging. See you there. Thank you.
Great. Thank you, Ville. Then Eirikur from Iceland, representing Arantxa.
Thank you. So I was a part of the private initiative that launched the Icelandic tracing app that Ingi talked about earlier. Our focus is on storing geolocation data on device, which our tracing team can request after infection while respecting the user's privacy. So this has proven very successful, as Ingi said, with around half the adult population having the app. And we plan to integrate Google and Apple's Bluetooth tracing protocols. But the app is open source and could be used by other countries. See you in breakout room 2.
Great, thank you. Then our next company comes from Sweden, Quizr. Jens, please.
Hi, my name is Jens. I'm one of the founders of Quizr. In this session so far, we've covered a lot of direct responses, but as Bradley mentioned in the intro, there's also a massive impact on companies, resulting in extreme measures being taken to survive. The result is that production countries and factories are heavily affected, and also millions of workers in supply chains by these business decisions. At the same time, there's no on-site visits, no audits, there's no trainings taking place. So to support, we use our digital, scalable and measurable and transparent training tool to ensure that health and safety, worker rights and workplace dialogue can continue to function in these factories producing for physical and online retailers. You can listen more about also how we give away some of our solutions for free in room 2.
Great, thank you. And then the last but not the least, we have Julian Parr representing Palo IT. Julian, please.
Hey, hi there, guys. I'm Julian Parr. I represent Palo IT. The solution we've been working on is Virtual Bed. Virtual Bed is designed to allow COVID-19 patients to monitor themselves in their own homes. The monitoring metrics such as heart rate, temperature, and so forth are sent back to healthcare professionals, and they can view that data in a dashboard. And patients are automatically triaged based on their news score, the number of comorbidities, and their age. And it also allows healthcare professionals to make contact with those patients who are most in need. So, and we'll be talking more about this in breakout 3, I think. Thank you.
Great. Thank you, Julian. All right. So now it's time to go to our breakout rooms where you have opportunity to hear more from these companies. So the companies are presenting 3 minutes each, and then we will open the floor for the audience for questions. And also then the room number 1, which is a country room, that room will be open directly for the questions, as we have already heard a lot of good solutions and challenges and lessons learned from each representatives. So to summarize, breakout room number 1 is for country representatives. That room is moderated by Phil Rohiding from UNDP team. We have Ann, Arild, Marko, Ingi, and Chee in that room. Then room number 2 is dedicated for companies, and that room will be moderated by Riku Mäkelä from Finnish Embassy. And we have Matti, Kudion, Jens, Eirikur, and Virpal in that room. And then the third room is moderated by Callum Hanford from UNDP. And we have Ninja, Dignio, Omsu, and then Palo Alto in that room.
I think we missed Vidar's introduction to his company as well.
Oh, apologizes for that. So I'm so sorry. Vidar, please, stage is yours.
Okay, thank you. Omsyn is designed to monitor patients at home. We collect data from a wide range of sensors. The bed sensor is attached to a bed frame, monitor vital signs without being in direct touch to the patient and without the assistance of either patient or helper. Sensor data is transmitted continuously every second. Artificial intelligence both help detect and predict deterioration of a patient's condition, like the silent hypoxia. This makes Omsyn ideal for early detection of patients at risk, and meet me at room 3. Thank you.
Great, thank you so much, Vidar, and once again apologizes for that. So, all right, so the access instructions to the breakout rooms are available on chat box, and also for all the participants. So as you probably have noticed, this session has been recorded, so we will share the content then later on with all the participants. And also then all the contact details of all the speakers, all of our companies with some additional material will be shared with all the participants by the end of this week. So watch your mailboxes with that. Next, I'm going to hand over to our moderators. So Callum, Phil, and Riku, please kick off the breakout room sessions. And before we do that, big thank you again for all of our panelists, all of our companies, Bradley, UNDP team, and of course, all the participants, and looking forward to continue this conversation with all of you in the breakout sessions. Moderators.
Yep. Thank you from Sami and to all the panelists. Super, laser focused and really relevant to the whole world's problems. So thank you.
Thank you.